My name's Josie and I'm a pre-registration optometrist. I'm 2 months into my pre-reg year at the moment and I spend 4 days a week in an independent practice in Kent and then 1 day a week at Moorfields Eye Hospital where I do observations. My standard day would involve me getting into practice about half an hour early, and that's to set up all my equipment and make sure the slit lamp's focused for me, and also to go through the patients you have for that day, because it's important to check previous records and make sure you're aware of what's coming in and how to deal with it. And then my first patient would come in at 9 and I spend normally about an hour to an hour and a half with them. If they do need glasses, then I would follow through and do the dispense also if there was time. We also have an OCT imager, so we use that if there's anything questionable at the macula, and I see about 4 to 5 patients a day. And they could be a mix of contact lens patients and also normal eye exams. And they're not limited in age or groups. You see anybody who's willing to spend that extra time with you. The first few days were more like an introduction to how things will be. I just shadowed a few eye exams and some dispenses and get used to how things run, because it's different in each practice. I hope that I picked things up relatively quickly and also that I had a patient within my first week, because I think if you postpone it a little bit too much, it can build up your nerves more and more and more. Fortunately, that was the case. Within my first week, I saw a patient, and so it slowly eases you into it. And it took me about 2 hours going into that first exam, but it's sped up since then. For my second patient ever, it was a patient who had quite small pupils, an extremely dense cataract. I had to dilate the patient. That was quite overwhelming to begin with, but fortunately the patient was very relaxed and was able to give plenty of time. But there was a lot to go through and a lot of different avenues to address in different periods. So I did knock on my supervisor's door 1 or 2 times during that eye exam just to double check that I was doing things correctly and going in the right direction. It was really scary, but everything went smoothly and it actually got a good image of the fundus through that dilation, so it was worthwhile in the end. I do observations at Moorfields, and this is where I sit in with a consultant or a senior optometrist when they are doing a routine on a patient. For example, in contact lenses, they'll be doing contact lens fit or an aftercare, and I sit in and see their communication with the patient, but also I'm able to have a look on the microscope and see how the lens fits and double check that I agree and understand what the optometrist is talking to the patient about.
So what would you advise for that, do you think?
It's quite superficial, so maybe comfort drops if there was any irritation.
Yep.
I'm in a different clinic in the morning and a different clinic in the afternoon, and so I varied about. So I was in the injection clinics a couple of weeks ago, and that's seeing patients who maybe have wet AMD or any macular edema and things like that, and you're assessing them before they go and have their injections to see if it's needed or to see the next recall date. So that was really, really good. And cataract is another clinic that I've sat in on. It's quite useful to put in practice because the questions they ask can make sure that the patient is definitely sure that they would like to go through with surgery and knows the risks and precautions. Next week I'm in accident and emergency in the morning, and I'm extremely excited about this. I'm expecting to see loads of different conditions that I haven't seen before. I'm yet to see anterior uveitis, so that's definitely one that I'd be looking out for, and also a retinal detachment. I'd quite like to see Schaefer's sign and tobacco dust, so I can't wait for that to come around. You see so many unusual conditions that you wouldn't necessarily see in practice, especially contact lenses. They have so many keratoconic patients. That's been really interesting to see. So I hope it's helped my communication skills, because I've been able to pick up little phrases and terminologies that optometrists use to the patients, and I have been able to take those back to practice and use them there. And so, like I say, you won't be able to feel this because of the numbing drop, but the scariest part is it just coming towards you. But if you just try and focus on something here and keep your eyes nice and wide open, and relax your eyes, nice and big. That was about 17, well within our normal limits, which is between 10 and 21. Okay. So you're down in the middle. And it wasn't too bad, was it?
No, it's fine.
My supervisors are extremely keen for me to find any courses, and if they're going to be useful, I just ask them and they're more than willing to let me go. I've spent a week volunteering at the Special Olympics, and that was doing vision screening, so it was very hands-on and doing distance VAs, cover tests, colour vision, stereopsis, things like that. And I also went to a lecture on myopia control. We discussed a new soft contact lens called MySight for myopia control at this conference, and I actually came back the next day and discussed it with my supervisors, and we've signed up to be one of the practices that can distribute it, so that was really useful. I chose this practice just because it's in a good location and they're really at the forefront of optometry, doing orthokeratology, scleral lens fits, and they also have diabetic screening going on in the room at the very back of the practice. So there's a lot to take in and a lot to learn. I did some work experience as an independent when I was in school, and I got used to the way things run. I quite liked there was a relaxed atmosphere, and also the patients you follow through almost from when they're a child to when they're adults. There's very good rapport. My advice to anyone going into their pre-reg year would, don't be scared at all. Everyone's been at the stage you are at now, and they've all gone through it, so they know how it feels. It's quite daunting when you first start going into full-time work, but you will get used to it and you will begin to settle down. And just enjoy it, because it's a year where you're going to learn so much and you're going to see so many conditions, and so make the most of it.